Well, so yesterday we had the first HFMA Northern California think tank, and it's similar to a problem solving, but it just had a bit of a different structure, and we spent quite a bit of time really digging into topics broadly and deeply. And I wanted just to first thank you for your contribution. It really helped spark conversation and got people really thinking. But I also wanted to get your thoughts on, was it worthwhile, and how do we make this, how do we take this to the next level to make our organizations to the next level?
You know, I have to tell you, what was done yesterday was groundbreaking. To have a room that you had so many providers, it was a provider-filled room with the provider voice open, and letting the providers choose the topics and then really dig deep into the good and the challenges and come up with some ideas. Everything wasn't solved, but the conversation was had, and people actually started linking up together on how they want to take next steps. It was amazing, and I personally believe, and the noise in the room was, this is something that has to happen at a national level. This is something that we need to do in other states. It's about time that we take charge of this industry again, that we start actually not accepting the plight of healthcare, but revolutionizing and redefining healthcare. And that's what happened yesterday. It was a first step, and it's all little steps. And I gotta tell you, you did a great job as the moderator.
Thank you.
You know, this was an investment in time that we had over 5 hours of dedicated time with providers. Think about that, 5-hour investment, and it was a full room.
I was concerned we were going to have, engagement wane, and I think there was some level where there was some energy that was just because people are starting to get tired and they needed to kind of take more breaks, and so I think we can learn from that. But the fact that the content was curated and then in real time, it was, we chose, we just, we could do a thumbs up, thumbs down. If there was a question up there that we were wanting to tackle and there was anybody really wanting to bite on it, it wasn't going to be, somebody sitting up at the podium talking about a topic. Right. It's not about that. It's about what are the things that keep us up at night, and how can we solve those? And we talked about what made it successful, and what made it, challenging, and really inviting different views. So there was a lot of people saying, yes, same thing, I want to build on that. The other thing, there was some folks saying, we are handling it in a different way, and I'm not sure if it's working all that well, but it's working for us. And I think that's the thing we really need to unpack, is it's all about context. And then how do we take that context and create a toolkit and a set of approaches that we can help people make good choices and try.
Yes.
I think at the end, where I ask people to pick something and do something, no matter how small, to keep the thing moving forward, I think now the question is, how do we bring that back and create a report out? That's going to be difficult, but I think that's the next step in this.
I totally agree. I also want to bring out, there were topics that were brought up that I haven't heard in HFMA in a very long time.
Like what?
Unions. How to lead in a union environment. Mm-hmm. How to take care of your team so your team has purpose. But we didn't talk in very high levels. We got down to nitty-gritty work efforts and how to change things from task to purpose. It was amazing, the ideas that came out and how we focused across the revenue cycle. We talked about RI, we talked about coding, we talked about patient financial services, and we spent a lot of time with patient access. That was amazing. The detail that we went into was really what was game-changing, because it wasn't, like you said, someone standing up there and doing a presentation. It was the people that are living the pain talking about how they're solving things and also where they need help.
Right.
That was amazing.
Yeah, I think there was some folks that really were passionate about certain pieces and bringing up some topics and some ideas as to, I think we need to do it this way from their lens, and then having a conversation. A good example is, all the revenue reporting versus, not billing for it because you want to do a denial prevention. That there needs to be a lot of conversation about that. Because ultimately we're trying to figure out how to prevent denials, but then there's this black hole that we create, and this gap that we are we're essentially letting the payers dictate how we're actually billing them. And while that may be appropriate, I think in some cases it's also taking the full story away, and it's creating a data gap that we just really need to fix. And
Totally agree.
there needs to be a conversation about how we really tackle that, looking at all of the different facets. And I don't have an answer for it. I don't want to have exception work with denials, but at the same time, I also don't want to have people, essentially not reporting what revenue we actually have.
And not only that, there's the cost element that goes along with that.
Yeah.
The fact of the matter is, those are services that were done. We may not be getting reimbursed for them, but we had resources and costs associated to them.
Right.
And when we start looking at our 990, and we start looking at what the cost is to do the work we do, we are, because of the payer restrictions, actually shadowing what it really costs to do business. And patients don't even understand.
Right.
And we had a major conversation about the patient and making sure that they were a driver in their care.
That was the thing that was really interesting to me. We had a comment that was made that I think all of us looked around the room, were nodding, and had no idea how to solve the problem.
Yeah.
And that's the next topic to really dig deep in, and that is, how do we truly get our patients to understand the payment mechanisms within the healthcare system specific to them, and have it be something that's accessible and understandable and that you can easily scale? Because there was some really interesting information and kind of an intimate personal situation shared that really resonated with all of us, that if we're in revenue cycle and we know how the system works, all the mechanisms, and yet we have a hard time being able to explain it to patients, how can a patient understand it? And it's so critical. If we're saying the patient needs to be in the center, we are keeping them out of that because it's just too complicated. We're going to need to solve that, and we're going to have to figure out how to do that. So I think that's a next day thing. Really exciting for this to happen and keep going. I think that's the key. We need to just keep the flywheel just started.
That's right. We took the first step, and this step is one that we are going to carry through. And more importantly, we're going to make sure that others get the opportunity to also take the step that we just did and join us in the conversation, providers trying to solve the future of revenue cycle.